this tibia belongs to the right extremity because that is the ankle. Oh, no, excuse me. Yeah, left one, that's the ankle. Like that. So it's right here. And that is fibula, very curved, probably like a vitamin D and calcium in the child. So this one is going to be like that. Like this. So obviously, thin and fragile that is located on the side is easier to fracture. Makes sense.
The tibia.
It's fibula.
Fibula.
And the foot is sitting in this niche. It starts. It's like insert for it. Like this. See? Kind of goes over the bones of the foot. Okay, that is pelvic bone, 1 of 2. They have only 2 left ones. I'm surprised. There's no separate sacrum. I checked the whole box. So it's left and left. So that is how it's located. So this pubic to pubic, and then that's where acetabulum is, and the hip bone goes into here. That is that curve, that bone that we feel.
The salsa bone.
My mom, besides being OB, she also does belly dancing.
Ooh.
That's like a cool picture.
I hear it's all in like the knees and the hips, like your legs.
Oh, tummy, and the more tummy you have, the better belly dancing. that's where the flat 6 packs is it's nothing.
Underrated.
There should be a yes.
So what you're
This
saying.
Some cushion for the pushing.
I'm ready.
It's just so good.
You got a close room.
Yeah, belly dance. Belly dance, you should have a belly. You cannot have a flat desk.
Depending on the type of pelvic
Yes.
you have, it's like different names for them, but yeah.
And so pubic, ischium, ilium. Pubic, ischium, ilium.
One with ilium, is it right?
Ilium.
Issue.
Are we sitting on an issue?
Lily.
You're sitting on it, your butt is on it. If you are skinny, you will feel that part, and you will have bruises, or like if those who are skinny and sitting on the computers all the time, they have deep tissue injury right here on the ischium. Yeah, pubic is that one, and that is the sexy ramus. And right here is where the sacrum is. So one side, sacrum in the middle, another. I have 1 out of 3 components of the pelvis, but so if the fracture is only here, patient is weight bearing. If the fracture involves area with acetabulum, the niche for the bone, that patient is not weight bearing. So if this ramus is broken, this ramus is broken, or this ramus is broken, no weight bearing. Makes sense when you see the bone. All right. Carpal tunnel syndrome. What is that?
Hands.
The nerve, like right in here.
Yes, which nerve?
Don't ask.
Medium nerve.
There we go.
Oh,
So there are 3
the
nerves.
carpal.
There's radial, ulnar, and in between. Median nerve. So it is compressed and it hurts. Which position of the hand and wrist is detrimental and may lead to this?
On the computer mouse?
On the computer, yeah,
Also just doing grabbing.
Or
doing
sending-
grabbing,
Any repetitive motion.
knitting,
Ooh.
knitting, doing like small dental procedures, doing ortho procedures, so everything that involves this kind of motions.
So would that be like a flexion?
So anything.
It's pain, yes. Mostly flexion motions, flexion and grabbing.
People in wheelchairs, my uncle had to have carpal tunnel surgery on his wrist because of that.
Oh,
Yeah.
that's a good one, huh?
It classified as repetitive stress injury.
Oh, it can be really painful.
They
I
can be
got
very
it.
painful and they can be debilitating if that is a provider, and you will be working with that provider, who has this carpal tunnel problem on the right hand, and they do surgeries. They cannot do surgeries because of that pain, so they need to go and have a surgery for themselves in order to alleviate the problem and be able to continue to work. It's that serious. What is the proper ergonomics for example, work on the computer?
Have your wrist elevated on the little
Yes,
cushion.
have the wrist
Stay
elevated.
on there.
I absolutely love socks.
Oh, yeah.
Yes, I love your socks. I have alpaca socks and pain could be worse not with the motion but at night. So during the motions, during the work on the computer, during the like surgical procedures, when the patient is doing certain things, they experience pain. But it becomes much worse when they are resting. They may also report numbness and paresthesia. Don't bother with the file maneuver, it's not gonna go anywhere. Therapy. Non-surgical and surgical. Unfortunately, surgical management is the only treatment. Non-surgical with proper ergonomics, proper positioning, or giving up the job, so there's no exposure to those repetitive stress motions. Those can be considered as a treatment, but I'm not sure if most people would agree to have that. So pain medications are good for only some time, but the surgery is the only one relief. Please recall and remember the word ergonomic for proper positioning, body healthy positioning. It's the whole scientific branch, and it's not only for carpal tunnel syndrome, it's for many other things. Scoliosis, for example. All right, knee injury. This is a very basic slide, and I'm not going to add much more information to that. What can cause knee injury in the everyday, your type of life? Think about that.
Falling. Like you
Okay.
trip, you fall on it, like you twist it.
Sitting on these,
All right, overweight,
just constantly walking
constant stress,
and lifting, pulling, tugging.
okay, weightlifting. Yes, age,
Ergonomics.
ergonomics, yeah. Specifically, positions of hyperextension when you lock the knees. That is a very, very bad. Running, unfortunately, as much as I myself love running, running is bad for the knees and hips and the spine.
Just keep doing it.
I'm gonna keep doing it.
Yeah.
I might alleviate other factors, but I cannot give up my running. That's my drug. So repetitive injury is one of the most common things. Rise mnemonics, please remember, you did this with Andrew when he fell. Rest, ice compression, and elevation. Rotator cuff injuries. What can cause it?
Lifting.
Lifting. You just feel it pop,
Mm.
and that's it. What else?
Can you also do repetitive motion when you rotate?
Yes, but with excessive things. For when you are the nurse, things that you should not do by yourself is to lift the patient, help the patient into the bed. Like for example, I'm very bad at this too, I must admit. If I have a patient who is, I'm just looking there smaller than me, I'm young and strong. And in the morning it's busy, everybody's busy, you cannot find even one nurse to help you with anything, and there are no CNAs. So the patient ambulated, and now it's time to put them in bed. So the patient is sitting on the side of the bed, and obviously the chest tubes are hanging here, Foley is there, pacemakers on the other side. So you need to kind of grab the patient's back, grab the patient's knees, and put them like this. Oh, that's bad. I just feel that my rotator cuff, I have only a few weeks left. I'm doing that, but that's where one is at risk. Bowling, yes. Throwing stuff,
You feel the click?
I say sports, but
yes,
Feel it.
absolutely. And also tennis and badminton.
acrobatics
Could be, yes.
or
could be.
gymnastics.
Absolutely, yeah. So the tear can be partial tear and full tear. Full tear, 100% surgical repair. There is no way out. For partial tear, we can try to avoid surgery. So minimize activity in that part of the body that you injured, whichever one that is, and pain medication. Now, let's do this case studies.
B. Or D.
D or B. Or actually C. Yeah. Forget that.
Just based on your clinical experience, what Katrina would advise you to do if you cannot palpate the pulse?
C.
Go get a Doppler, right?
Mhm.
So go get a Doppler, because Doppler is another thing that you, like diagnostic method that you can use without provider's order. Just go grab it. It's anywhere in the nursing station or plain storage, and check if there's any pulse there. Maybe it's just your fingers are so tough that you cannot feel anything because you were just doing your own move. I mean,
Yeah, you have to wear the gloves and then you can't sometimes.
But if he's in,
sometimes you can't.
but if he's in pain, wouldn't the Doppler hurt him more?
No.
Doppler's just like an ultrasound.
Oh, I thought it had the little wand thing.
No,
I'm thinking-
don't
I'm
put
thinking
them
of some-
up anymore.
I'm
Just
thinking
a
of
little
something
cold jelly on the pulse area, and that's it. Yeah, so before we report lack of a pulse, that would be a next step. But this is first. You need to do a full assessment to know up to which extent there is no pulse. Maybe there is pulse, it's just I don't feel it. And if you have another option here, or addition to the answer, compare it to the healthy one.
Why are we elevating? Why are we elevating?
Because it's injured.
Right.
It's the same injury,
Okay.
same guy.
It's a case study, it's a continuing case.
Okay.
Yeah, I'm gonna say C.
What are we, which one
What
do
are we
got?
discussing? That means,
We don't agree with what?
yes, we don't agree with some, one of those.